The following is a presentation of the dental auxiliary programs in the Department of Health Careers at Lansing Community College. This videotape will illustrate and demonstrate the periodontal probe instrument.
This program will provide an opportunity to become familiar with the purpose, design, and application of the periodontal probe. Since the periodontal probe can be used on all surfaces and has no cutting edge or sharpened point, it is a good beginning instrument. The primary purpose of the periodontal probe is to measure the depth of the gingival sulcus or pocket. It can also be used to examine the gingiva for bleeding and to detect surface irregularities and hard deposits. As the probe traces the topography of the gingival attachment around the tooth, you can evaluate the presence of disease and the health status of the periodontium. Look at the shank and working end of the probe. The shank is bent at a right angle to the working end. The working end is marked in millimeters and resembles a miniature ruler. In examining the working end more closely, notice that it is marked at 3, 6, 8, and 11 millimeters. The colored bands help facilitate the reading of the depth measurements. You are now ready to learn how to use the periodontal probe on sequence 1 of your typodont. Grasp the probe with a light modified pen grasp. Position the instrument in your hand so the working end is pointing toward the apex of the tooth you will be probing. For example, on the mandibular teeth, the direction would be down. Next, establish a fulcrum on the occlusal surfaces of the mandibular premolars in this sequence. Place the tip of the probe on the cervical third at the distobuccal line angle of the most posterior tooth. Maintain contact between the probe tip and the tooth and adjust the working end so that it is as parallel with the long axis of the tooth as possible. It is often difficult to keep the working end parallel and maintain tip contact due to the convexity of the cervical third. Gently insert the tip under the gingival margin. Carefully slide the tip down along the tooth surface until resistance is felt from the epithelial attachment. The attachment should feel somewhat elastic and resilient, like a taut rubber band. Of course, on the typodont, you will not be able to feel an attachment and will have to use your imagination. Keep the tip under the gingival margin and gently walk the instrument up and down along the epithelial attachment in a distal direction. This vertical walking stroke technique allows you to accurately follow the varying levels of attachment around each tooth. When you are sure the tip is at the middle of the proximal surface, the resistance of the attachment is felt, and the working end is as parallel as possible to the long axis of the tooth, read the measurement. On proximal surfaces, it is important to slightly angle the probe to reach directly apical to the contact point. An incorrect measurement will result if the probe is slanted too much so that it overreaches the midpoint of the proximal surface. If it is positioned at the line angle and is not advanced far enough interproximally, the most frequent site of periodontal disease will remain unexamined. Keeping the tip under the gingival margin and the working end parallel to the long axis of the tooth, move in a mesial direction. Stop at the middle of the buccal surface and note the measurement. The measurement on the buccal of this tooth is 3 millimeters. Continue walking the probe along the attachment toward the mesiobuccal surface. Remember to keep your stroke and grasp light so the patient discomfort is avoided and your tactile sense is enhanced. When at the mesial contact, slightly angle the probe to reach the midpoint of the proximal surface. The measurement on this mesiobuccal surface is 6 millimeters. Remove the instrument from the sulcus and move to the next tooth in the sequence. Remember to gently insert the tip at the distobuccal aspect of the tooth and proceed to the distoproximal contact. Then move in a mesial direction using a vertical walking stroke along the attachment. Be sure to maintain the tip on the tooth and within the sulcus. Remember, reinsertion of the probe can be uncomfortable for the patient. Continue probing on the buccal aspect of this sequence through the premolars. Next, move to the lingual aspect of this sequence. On a patient, a mirror will be needed for retraction and possibly indirect vision. Start with the most posterior tooth and move forward through the premolars. Remember to adapt the tip at the distal lingual line angle and proceed in a distal direction. Measure the sulcus or pocket depth at the distal lingual contact. Next, move the probe in a mesial direction around the line angle and stop momentarily to measure the lingual surface. Proceed toward the mesial to measure the depth at the mesiolingual surface. Sometimes you may feel the probe encounter a hard, unyielding deposit. In this case, gently move the probe away from the tooth toward the tissue wall and attempt to proceed apically past the obstruction. The next structure you feel should be the epithelial attachment. Continue your probing procedure until you have completed the entire lingual aspect of this sequence. Although the instrument is walked around the entire facial and lingual aspect of each tooth, only 6 measurements are generally recorded. They are distobuccal, buccal, mesiobuccal, distolingual, lingual, and mesiolingual. If a pocket is noted in an area other than these 6 locations, it must also be recorded on the chart. When completing a periodontal chart, record pocket depths of 4 millimeters or more on the appropriate buccal or lingual aspect of the chart. For example, this chart shows a 6 millimeter pocket on the distobuccal surface of the mandibular second premolar. Sulcus depths of 3 millimeters or less are considered normal and need not be recorded. In summary, when using the probe, it is necessary to use a light grasp, maintain instrument tip contact with the tooth surface, keep the working end as parallel as possible to the long axis of the tooth, use a gentle vertical walking stroke around the tooth, take at least 6 measurements for each tooth. Now continue practicing Sequence 1 on the typodont until you feel comfortable with the technique and can duplicate this procedure in your student partner's mouth in clinic.